Now from side-lying position, we will do a variety of exercises to focus on trunk movement. Before we start with those exercises, we need to establish an understanding with the patient regarding scapular and pelvic patterns. Starting with the scapula, we will do movement in two directions. The first one is this diagonal. So we move the scapula in anterior elevation and then in posterior depression. Then we will do this other diagonal. Let's start with the first one first. So I will place the scapula in posterior depression, and I will place my hand on the superior anterior superior aspect of the shoulder. My other hand will be around the inferior angle of the scapula, and my body is in line with the movement. So now, move your scapula towards your nose, please, up and superior, anterior and superior, okay? Now move it back and down towards me, okay? Let's do it again, up, okay? And down and back, okay? Anterior and superior, and posterior and inferior. Then up and in, okay? Down and back, up and in, down and back, down and back. Okay, good. For the other diagonal, the scapula and the shoulder will move down and anterior, then up and posterior. So this is the diagonal. The hand placement to resist this one is on the anterior shoulder below the coracoid process to resist the down anterior movement. And then for the other hand, we will put it on the spine of the scapula to resist the up and back movement. So here, move your shoulder down and anterior, okay? Move your shoulder up and posterior. Good job. Down and anterior, up and posterior. Okay, relax. For the pelvic movements, again, we have two diagonals that we need to train with the patients. The first one is the anterior superior and posterior inferior movement, okay? So now, for this movement, I will provide resistance by placing my hand superior to the ASIS on one hand, and the other hand will be on the ischial tuberosity. So, Zaid, move your pelvis up and in, up and anterior, sorry, okay? Now move your pelvis down and back, okay? Again, anterior and superior, okay? And posterior and inferior. This is one diagonal. For the other diagonal, and notice that I'm in line with the movement. For the other diagonal, I need to switch. And here, the pelvis will move anterior and inferior, okay? And then posterior and superior. And for the resistance, one hand will be placed, the heel of the hand on the PSIS, and the other hand anteriorly below the ASIS. So, move your pelvis down and anterior, move your pelvis back and superior, okay? Move it down and anterior, back and superior. And for this diagonal, if the patient's length and my length allow, I could provide the resistance through the distal knee, the distal thigh, sorry, on the knee, but not on the joint itself, just below it. And the other hand is on the PSIS. So, move your knee down, okay, and anterior. Now move your pelvis back and up, okay? Down and anterior, back and posterior, and I resist. Okay.